South Africa's National Health Insurance Scheme has now been signed into law, and NHI promises universal health care for all. It's faced celebration as well as fierce resistance, especially from private institutions and some of the opposition parties like the DA, which has accused the president of signing the death warrant of healthcare in South Africa. But among the issues facing NHI is a basic understanding of what it means, when it's likely to find life, and how it's going to be funded. These constitute some of the biggest issues. So a discussion is helpful. And with that in mind, let me welcome Dr. Peter Barron, a veteran public sector doctor affiliated to the School of Public Health Services at Wits University, Dr Angelique Coetzee, chair of the Health Committee for the South African United Business Confederation, and Catherine Pasane is a retired former nurse who worked in the UK under the National Health Service. That is their publicly funded healthcare system in England. So to all of you, thank you very much for your time and for joining us. And we really appreciate the insights you're going to share with us in just a moment. Dr. Barron, you were in the public sector for over 4 decades, and now you lend your expertise to academic institutions. And it would be really useful to hear from your perspective how you believe the NHI will affect the healthcare journey of patients in the public sector.
So that's a very difficult question to answer. A very short space of time. The premise behind the NHI is very sound in that they want to improve the quality of care for all South Africans and make it affordable.
All right, Dr. Barron, unfortunately, that signal is not great at all. And I hear what you're saying, that it's very hard to discuss some of these big concepts in just a minute or so and get a response. But I'll come back to you as soon as we can, because I want to talk about the doctors and some of the threats we're hearing that they might leave in droves if it is implemented. But Angelique, for months, you have shared your concerns around the need for this design of universal healthcare provision and how it will be funded. Now that it's done, what are your thoughts on whether still the funding question has been answered and the benchmarks have been met?
Well, yes, Iman, it's still a huge problem. All that we have is a ceremonial sign-in or signage of the bill into law. At this stage, we're still not knowing what its NHI is going to cover. I've said this many times, it's unclear, it's undefined, and we don't know. There is also no published attempt made to do a vitality study, a study to say, listen, this is what is needed, and this is how we're going to do it. So there's no comprehensive costing done, and that's a huge problem for us still. So because what we have seen is that there's an unrealistic expectations to patients out there and the people out there that signing this into law, miraculously, the private sector is going to open its doors for the public sector, and the public sector is also miraculously going to give good services out there. It's unfortunately not going to happen. We need to address the problems at primary healthcare level. There's problems in the public sector, there's problems in the private sector. I'm always saying the private sector is looking so much better because the bar is so low in the public sector. That's why everyone thinks everything is great in the private sector. The private sector's got its own problems. There's a lot of problems. I need to express as well that at the current rate, the contributions paid by members to medical schemes will become unaffordable within the next 4 or 5 years for the average person. And as we look at what is happening in the public sector, the current services, the infrastructure, the way we treat the patients, and the way we look after our people in this country is really, really in ICU mode. We need to get it out. We need to start working at a primary healthcare level, get the services fixed, get the problems that is there fixed. NHI is not going to fix it at this stage. Okay. We will still have the inequalities if we do not sit together and fix this system.
Dr. Barron, let me try bring you in. I know that our signal, went out there right at the very beginning. Maybe we'll circle back to that question, but I want to go to this issue around timing and funding. The public is being encouraged not to panic, because the actual implementation of the NHI is still a ways off. Medical schemes are also echoing the same sentiment. Health Minister Dr. Joe Pahla said NHI will be implemented in 2 remaining phases from 2024 to 26 and then 26 to 28. Government focuses on establishing that board, the chief executive and all the key committees of the NHI fund. Given that at this stage, as Angelique is saying, we don't know too much about how this is going to be funded, do we need to allow government the time then in these next few years to be able to sort that out?
One would.
Okay, Dr. Barron, I'm so heartbroken, actually. We still can't hear you, so we're going to try and reestablish that signal with you, and I'll bring you back again. Before I bring Katherine in, maybe, Angelique, you can take that question on government saying, you know, this is the rollout phase, and all this detail will be figured out there. As you say, we don't have that funding model, so the assumptions that are being made about the contributions to medical schemes being unaffordable remain assumptions until government tell us how they plan to do this and what Treasury says.
Yeah, listen, Treasury was very clear on this. About 2 weeks ago, Treasury said that the NHI will take many years to be implemented as there is limited scope to fund it with higher taxes. And we know that National Department of Health said it would be funded by taxes. So we are sitting in an economy currently that's not growing. We've got an extremely high unemployment rate, especially between the ages of 15 and 34. We have seen the stats recently this past week being released on this. So what people doesn't understand is that we're also sitting with an elderly or an aging population that will have more diseases like diabetes, cholesterol, hypertension. They need to be treated. And normally what will happen is the economic active people, contributing to tax, they will then subsidize these people. But now we have a very, very high unemployment rate. So who is going to fund, from a tax perspective, within the next 10 years, our aging population? It is simply not going to happen.
Take a breath there for me, Angelique, on that point. Just take a breath for me. And the beauty of being in a show that is also covering a bunch of other developing and breaking stories is that I'm going to park our conversation just for a minute or two and go to this. The Special Investigative Unit is conducting a search and seizure in Tshwane today. Let's continue our conversation with Dr. Peter Barron, a veteran public sector doctor affiliated to the School of Public Health Services at Wits University, Dr. Angelique Coetzee, Chair of the Health Committee for the South African United Business Confederation, and Catherine Pasane, a former nurse who worked in the UK under the National Health Service. This is their publicly funded healthcare system in England. I want to appreciate all of you for standing by with me as we heard what the Minister had to say there. Let's come back. We're talking about where the money is going to come from. Angelique, the last word you talked about was around creating higher taxation base in order to be able to fund the NHI. Dr. Peter Barron, because of the signal issues, we weren't able to hear your voice, but I'd love for you to come in and talk to us about what this could be, either in terms of a boon or what you'd like the public to know about the benefit of NHI, especially for those who are using public services.
There won't be any benefit. And if you heard from the Treasury, Dr. Mark Blecher is forecasting that it's going to take 30 years for the NHI to be rolled out fully. And if you think back 30 years ago, there were no cell phones in South Africa. So it's an awfully long time from now till then for this act to be fully implemented throughout the public and private sectors. And as Dr. Coetzee said, the act is quite opaque as to what is going to happen, what the benefits are going to be, and how they're going to be delivered. And so I think a good communication strategy from the architects of the Act would be useful so that everybody in the country knows what is going to happen, when it's going to happen, and how it's going to happen.
I'm glad, Peter, that you brought in the timeframes and some of the realities around when it might actually become a real and living thing that affects our lives against the backdrop of some of the milestones that government has set for itself. And given that you've said that, should the public then just temper their expectations in having access to universal health care of the kind that's described by government anytime soon? And should medical schemes also just kind of put aside their fears that they'll be rendered non-existent, if it comes into being, given, as you say, it could be decades before it becomes real to us? Peter?
Absolutely, but I think there are things that can be done. There's lots of low-hanging fruit, and there's problems in both the public and private sectors which could be remedied quite easily, and the quality of care could be improved dramatically in a relatively short period of time. But I don't think that the NHI Act is going to help with those problems. There's got to be better dialogue between the public and private sectors, and we've got to improve the governance throughout both and accountability. So those would be some of the quick things that could be done. Over.
All right, so in an NHS system, and I want to bring Katherine in here, the government runs and organizes the healthcare system. The government owns hospitals and clinics. The healthcare providers work as salaried employees of the government. In contrast, an NHI system relies on private healthcare providers who are reimbursed by the government or a government-funded health insurance program. Katherine, you worked in the NHS system for over a decade. What were your observations of how it actually worked, efficiently or otherwise?
It works very, very, very well because everybody will be treated as an equal, as an individual, with the care, compassion, respect, courage, and anything that we think of that really embraces health comprehensively. So the health system there is much, much better, that there's no a loophole that we're reminded that we need to go for this and that, we need to go to this appointment and what have you. And because it's come from one source and it's government funded, which is fantastic. Now, all what you need to start is that now the GP is a point of departure within the geographical area to be able to know who's staying within a certain area. They've got your name, date of birth, and the kind number with community health index. You can use anything that you really need to use, any number. Then within that geographical area, the population is so much. And then they've got to go to the GP first, the first point of contact. You will have your own dentist that within the area that you go to. And then if there is any medical problem that you've got, through the GP, you'll be referred to all the specialists. Those are based in the hospital setting. There's no disparity whether you are working or are not working because all the money is funded by government. There is a national insurance that everybody who's employed has to pay a certain percentage towards running the health. So as a result, you are being treated as equal. And because the salaries, the doctors are being paid by the government, there's no disparity. And you have got that commitment to provide the health care 110% and treated with dignity and respect.
As you look at the comparison between NHI and NHS, Katherine, what stands out?
I think the difference is because now most of the population here are not working. Number one. Number two, the geographical area, if you put such a small scale, of which I don't know whether it will be possible or not, that if you need to know that people stay in Randburg, I'm just giving an example, we've got the GP around the corner there, GP, where you want to register as your own GP, and then the dentist and whatever. If you've got that, you know that you'll be able to kind of sum up as to how many people do you have. But now if you don't got this no accountability or responsibilities as who is going to be very, very difficult. And here, each and every person who's working got to pay a certain percentage towards the health system so that whenever you go to the hospital, you're going to be treated equally. It doesn't matter what. Yeah. Now, there is going to be teething problem. This is just the foundation statement at the moment. There is going to be teething problems. And with each and every health sector, there's going to be problems as well. It's how you deal with it that really counts a lot. And I could say that now, yeah, it's how we deal with the situation that really counts a lot. But the government funding is the key focal point of running NHS and national health, and how they run it is how the finance is being spread out.
Right. Katherine, let me pick up on that point with Angelique, and I want to bring you in here. One of the criticisms by members of the public would be, Angelique, that, you know, medical schemes are worried that this poses an existential threat to them. They will be rendered non-existent. How do you, I mean, what are your thoughts on that, in responding to that?
So
I think
currently, if we look at the system, your medical schemes, in the end of the day, because of the high contributions that we have to pay on a monthly basis for those of us who's got our own businesses, who's not depending from state or other businesses where you are being subsidized, it is going to become unaffordable within the next few years. So we need to look at that. And that was addressed by the Competitions Commissioner inquiry that's been held. Unfortunately, there was no appetite from National Department of Health to act onto those recommendations that had been made for the private sector. So I want to bring in another point, listening to NHS. And yes, NHS got its own problems. Currently, there's lots of strikes going on with the doctors and the nursing staff, and it's all around about funding. But there was, Mr. Gore from Discovery Health recently told us, or make a statement, that if you look at the current healthcare costs in South Africa, and you then compare it to what is happening in NHI, he says there's a common misconception that NHI will offer a comprehensive package of benefits that is similar to those what we see in the NHS. So because the current NHI proposal counts for about 714 rand per person per month, which is a quarter of what the NHS costs, even after allowing for purchasing power parity. So private care currently in South Africa costs around about 2,323 rand a month. And even after you have removed any potential profit, the figure would only drop to 2,028 rand a month, which is still 3 times higher than the NHI's proposed 714 rand a month. And so there will always be gaps in this cover. The out-of-pocket was said by Dr. Alex van der Heever. He recently showed some data where it was said that South Africa has got one of the highest out-of-pocket payments, and there's actually nothing that confirms this. So according to the World Health Organization, out of 187 countries, South Africa has around about the 11th lowest out-of-pocket expenditure. The World Health Organization, 2000 to 2020, with expenditure of less than 1% of GDP. So out-of-pocket is not the biggest problem here. And, it's always been used as well as a problem. We need to, so my current fear is, while we're now waiting, we are a country that loves to wait. So we're waiting for miracles to happen. We're waiting for 2020, 30. We're waiting for 2026, as per what the government said. What is going to happen in the meantime to the public sector, clinics and hospitals, that is not functioning properly? So are we now going just to let them just go down the drain?
All right.
Or are we going to stand up and fight for services? That's what we need to do. We need to fight for services and better the system in the meantime, because maybe NHI is not going to happen in my time. I don't know. There's no guarantees.
Angelique, it's a very good point that you raised. So let me bring in Peter on this one. So the one thing is, it's not going to benefit people now. It's not going to be real to people now, Peter. But for a lot of people who think about the high costs of medical aids, despite some of the numbers that Angelique is sharing comparatively in other markets, it is a pain point for people, right, to be able to pay medical aid. And the desire is we pay taxes, and if the public service hospitals could work as they should, if they were optimal, and the medicines were then cheaper because government would be a big procurer of the medicines, so the prices would come down, it would just be an absolute dream. Many of us would want to use the public service. What do you say then, Dr. Barron, about, and you can reflect on the concerns that Angelique has shared, or the observations that Katherine has made, but this is the desired destination for healthcare provision in the country. universal, cheaper access, same healthcare for everyone across sectors. And given, as has been pointed out, that we're not going to get it anytime soon, what should government now be doing then?
Well, there's so much that could be done, and the quality of care
in both the private and public sectors is suboptimal, and there's a lack of accountability, and there's a lack of stewardship, and there's a lack of good management. And I think if these things could be corrected, and each and every health worker was trained to do their job properly and did it properly and was made to be at the facility where they're supposed to be working and had good quality of supervision, then I think that both sectors would be improved immediately. In the public sector, in some places in South Africa, it showed that you can run good services. But if you look at what's happening in Gauteng and the Eastern Cape, just as two examples where there's rampant corruption and political interference in the running of the public sector, then it just shows you that politicians should stick to policy making and that they should appoint good managers to manage the health system. So I think that if there's better management throughout the system and more accountability by each and every health worker, it would take us a long way forward from where we are now, because we're certainly not getting good value for money for the resources that we have now. And just to echo Dr. Coetzee, we can't strive to give the same level of service as there is in the UK, for example, because the economy doesn't generate enough resources to do that. So we have to temper our expectations about what can be available for all South Africans. And it's not going to be at the same level of the countries in Europe or North America. Over.
Katherine, let me give you the last word then, having worked in the sector. It's not exactly the same. There are some differences between how NHI and the NHS system does work. But what would you like to share, with South Africans on our journey potentially to there? And despite some of the issues that Angelique has also pointed out, even within that system, some of them could be around longer waiting times for certain procedures and certain access to different specialists and so on. What would you like to share with the South African population on the journey to achieving the dreams and the objectives of NHI?
I do agree with Dr. Barron the way he's saying that we don't have to compare ourselves initially with National Health Service. The economy there is not the same in South Africa. With the potential that we have, we can achieve something very, very tangible and very, very much important. As I mentioned earlier on, there are going to be teething problems here and there. It's how you deal with the situation that really counts. And secondly, our institutions for training, they need to be monitored. I do agree with that. And also got to lead by example. And if you lead by example, nothing will go wrong. So responsibility and accountability is the most important thing. National health insurance, to me, it's a very good comprehensive national health that is really going to benefit almost every South African. It might not happen now, but in the later stage, it would be. It's a system that really need to put in place. All the stakeholders need to be put around the table to be discussing the way forward. And the most important thing is going to be the budget, where it's going to come from. And everybody, all South Africans, they need to contribute a little bit that they've got towards the health system. It doesn't have to be, in millions and whatever, because we're going to have that disparity. If we start having a disparity that I've got so much money, I can afford A, B, C, D. He has got not much money, cannot afford A, B, C, D. That's where the problem is. When coming to health, maternity, medical problems, mental health, all those things could be really be treated and brought to book and be treated very, very well without having to deal with the end product that we're dealing with. Because once you have the end product that's related to health, it's going to be difficult and financially costly to start managing that. But if you can deal with that at the very, very primary level, it will be much better. And also collaboration. collaboration with all the stakeholders. I mean, we've got quite a lot of retired nurses with very expertise and, mind you, experience override qualifications. And that encompasses all those 6 key factors that are really needed in the care sector. The care that is really needed, the compassion, the commitment, the competence, communication, courage. All those aspects are really, really important in the health sector to be able to provide the care that we really need.
Going to leave it there. It by no means is the end of the conversation. As we heard from one of our reporters in Tembisa, for example, many members of just, South African society don't even understand what the basic concept of NHI is and how it's going to affect their lives. So in this gap in between now and when it eventually comes on stream is a lot of work, as you all have assented to, that needs to be done in educating and informing the public. Dr. Peter Barron, a veteran public sector doctor, thank you very much for your time this morning. We appreciate it, as well as Catherine Pasane, a former nurse who worked in the UK under the NHS, and Dr Angelique Coetzee, chair of the Health Committee for the South African United Business Confederation. Really do appreciate your time, and thank you.